Hello, ladies and gentlemen. You are watching the Amarian talk show, and I'm your host, Amarian. Today, I'm gonna have an amazing topic, and Dr. Faraj gonna tell us more about our health. First of all, doctor, thank you very much for coming, because when I discovered that problem that we're gonna discuss today, I understood that each and every woman has to know about that. So, first of all, please introduce yourself, tell us more about you, and about your amazing career, please.
Certainly. Thank you very much for having me. My name is Faraj Hanna Alkas. I've been practicing medicine for more than 25 years in a hospital setting for the last 5 years. I'm concentrating mainly and helping people having vascular problems, i.e. people having problem with the legs, arteries plugged because of diabetes, hypertension, cholesterol. In addition, we are helping women having uterine fibroids, which is going to be the main dish, for our discussion today.
Yes, exactly, because it is very important to know, because when I met you and you told me about that huge problem, I started thanks to you, discover more information about that, and I understood that every woman has to know about that.
Right.
And you have the gold, you have the information, how can we treat it without any surgeries. So we're going to speak about that a bit later. But today I would like you to explain us what fibroid means.
Yes, you're absolutely right. Uterine fibroid is underdiagnosed, and women are undereducated about their treatment options. Fibroids are the most common tumor, pelvic tumor, in women. And this is bad news. The good news, they are benign. I mean, they can stay forever. And, regarding the behavior of tumor, malignancy, it's all benign. The problem is their presence compete with other structures in the uterus. So the women pelvis is a very crowded area. So just having the fibroid, depending on the locations, women will have their symptoms.
Okay.
And they're frequent, as you said, and depending on, it's different races have higher incidence. But between 70 and 80% of women will have uterine fibroid by the age of 50. This is a huge number.
Huge.
And the thing is, smaller percentage will be symptomatic. But again, since the percentage, the number of people having fibroid is around 80%. So no matter what, how small is the percentage they're going to have the symptoms, it's still a large number.
It is 80%.
Yeah, and it has so many symptoms regarding where the fibroid is located. So I urge women, this is not a story that we can discuss it with neighbors or with relatives, or because no individual will have the same symptoms.
Let's speak about symptoms. For example, like a normal woman, she lives her life, and then what she has to feel.
You're
to
absolutely
understand.
right. Yeah, this is way in the pelvis. So symptoms, again, location. It's like in the real estate. It is where the fibroid is. The symptoms is going to follow.
So where can it be? Because I know that there is a full location.
Right. You're absolutely right. So let's continue with the symptoms. Symptoms, you can have a prolonged menses, long vaginal bleeding with period. This is the most symptoms that patients seek medical attention because it is misery, honestly, at the level of the social life, quality of life, hygiene, sexual
Absolutely.
life, it affects everything. Usually normal menses, it should be between 3 to 5 days.
Okay.
Start, very heavy, then it's
Yeah, yeah.
slow,
Down, yeah.
Anytime, your period is longer than 7 days, don't say it's genetics. My mom has it, or maybe your mom has fibroid, and it was,
And she never
she was living, her life until she got menopause, and slowly fibroid regress with menopause.
Oh,
So
wow.
if you have heavy bleeding, associated with cramps, pain, this is abnormal. And what I mean by, heavy bleeding is you change pad every 2 to 3 hours.
Wow.
If you have clots bigger than the probably size of the quarter, you're passing, if you have gush of blood, again, this is abnormal. It could be from fibroid, or it could be from something else, hormonal imbalance. So you have to seek medical attention.
Yeah,
So
that's
this
very
is the
good point. Very good
right.
point.
So this is the most important symptoms that women seek attention. The other one that people sleep on it, like the bulk. There are two symptoms category. I divide them. The vaginal bleed. The other one is the bulk. Being pelvic pain.
Okay.
Sometimes the fibroid is way posterior, sit on the bowels or on the nerve, pelvic nerve, give some, numbness, radiating all the way to the leg, thigh. It simulates like sciatica.
Okay.
And if it's sitting on the bowel, people, will have constipation. The other thing is, if the fibroid is anterior, where the bladder is sitting, it will be sitting on the top of the bladder, causing pressure.
Oh, wow.
In this way, women has to go frequently
Yeah.
to the restroom to pee,
Makes sense,
because now the bladder, the urinary bladder, is half the size or less. Keeping in mind, fibroids, though they're the same origin from the muscles of the uterus, they're harder.
Okay.
So that's why, when they're, in place, in a location, they make it clear for the adjacent organ. And it just, for other women, they might tell you, oh, I don't have fibroid, I have myoma or leiomyoma. All these are the same.
Oh.
The myoma or leiomyoma is the medical term. Leiomyoma is, the smooth muscle.
Okay.
So they're under the same category. So you will have various, symptoms depending on the location. If the fibroid is way low in the uterus near the cervix, people might have a something called in medical term dyspareunia. It's pain on intercourse.
Okay. Oh, wow.
Yeah. So there are various, it might affect fertility for two reasons.
Yeah, that's actually my question. What fibroids can affect?
Yeah.
Yeah.
I mean, it could affect, there is a huge question what fibroids will cause to pregnancy.
Yeah.
It can hinder, fertilization of the egg.
Okay.
Also, it can, let's talk about fertilization of the egg. If the fibroid is next to the cervix, it might hinder passage of the sperm.
Oh, wow.
Because it make the lumen smaller, or it might occlude it completely. Similar situation is the fibroid near the fallopian tube.
Okay.
This is way high in the, in the uterus, where this is pretty much the fallopian tube is the tube or the tunnel where the egg be transferred from the ovary to the uterus.
Okay.
So any disruption in this mechanism, either the sperm transfer or the ovary transfer, and it's time sensitive because either the egg or the sperm has half-life.
Yeah, of course.
So any delayed, even if they arrived like, they should be ready for fertilization, the egg and sperm, within 24 to 48 hours. Any longer period, both are, they lose some of the activity that, to have a smooth.
I like the metaphor that you told me before the show. I would love if you will tell it to our viewers, because none of us have medical education, and I love the metaphor with the road that you told me. Like, please tell it to us.
Yeah. We were talking about, passage in the fallopian tube, or passage from the vagina to the cervix to the uterus, the sperm. So this is very important, the time sensitive, these are cells, and they have to arrive to their destination to make their, so beyond 3 days, the ovary, the egg is not functioning anymore, same thing. So the way it is, to make like my patient understand it, it's like highway. If you have highway and you have 5 lanes, so the flow will be going very easily. For some reason, if there is compression, like accident or something, you go to 2 lane or 1 lane. I mean, everything will pass at the end, but instead, there will be delayed in getting the sperm or the ovary where it needs to be in timely manner.
Yes, exactly.
So it will be useless. So this will be one way affecting the fertility. The other thing is, remember, every month, every cycle, because the cycle is different. Different women has different, cycles. But beginning, once the menses happened, the uterus start preparing for the new embryo. Because the uterus thinks that every cycle, the uterus should be prepared to accept an embryo. They don't know that man and woman, they're not planning to, to do baby. So this is how it is. Each cycle, this endometrium, the inner lining of the uterus, it starts building up like a mattress. It's called the endometrial thickening. So it starts building the mattress, which is on the top part of the uterus. So this mattress, if fibroid adjacent to it, it might disrupt the configuration of the mattress. So if everything is fine, if the egg and the sperm, fertilized, it will be problem for the embryo to sit on this mattress, because the fibroid, as we said, it is hard consistency. So it deformed everything adjacent to it. So this lining mattress, it's going to be distorted, and this is number one cause of, if there is a fibroid, you have to think about miscarriage, early termination of the pregnancy, because there will be competition or not enough implantation of the embryo in this mattress. So this is how it is. And if this will be one of the symptoms of submucosal fibroid. We have 3 categories, submucosal and intramural fibroid. It will be within the muscle of the uterus. The other one is subserosal. It's on the outer lining. And this, fibroids gives the bulk symptoms that we talked about, by compressing on certain adjacent structure. It's like, I tell my patient, it's like when you're in, long flight and you have some fellow passenger, just, all the flight, sleep and his head is in your lap. This is how a fibroid does for, adjacent structure. Push on the nerves, push on the uterus, push on the urinary bladder, or any adjacent structure, depending on the location where the fibroid is. So going back to, the fibroid in the submucosa, we talked about is going to be to the, near the inner lining. So what happened at the end of each cycle, this mattress will be shed out. It will be go out. It will be, represented by bleeding. So this is, so what happened when the fibroid is adjacent to the mucosal lining, it will make the healing process. This is how it is in the beginning. There will be a gush of blood and then start slowly decrease. So presence of the fibroid in the near the submucosal lining, it will hinder the healing process. That's why women keep seeing bleeding. So this is pretty much, in brief, the locations of the fibroids.
Locations define your symptoms, so that was very important. Important thing that we just discussed. And I think the question that each of us will have: how can we heal it, get rid of it, or?
Okay. Yeah. First of all, bleeding or pain in the pelvis or back pain, there's a huge wide of differential. So probably the investigation start with the patient's woman PCP, or she might get her gynecologist. So they will start by pelvic exam. He might feel something or he might not feel something on the pelvic exam, depending again where the location of the fibroid. So next step, most people goes to pelvic ultrasound. More sensitive is transvaginal ultrasound. It will show better the fibroids. So at this point, you will start having some suspicions. But I always ask for MRI. Anytime there is a fibroid disease, I ask for MRI. It has better resolution. It shows, the whole pelvis. Ultrasound has a limiting capability, depending, different patients have, different body types. Remember, there are some probably structure in front of the, probably bowel loops,
So it's not accurate. It's not accurate.
It is accurate, but it's not wrong. It's like when I go check some apartment, I'm going to buy it, then I will bring the real estate agent, which has
an inspector.
more experience. He knows where to look at. So the MRI is like this. It shows more. But sometimes it's very common that you see 2 fibroids on ultrasound. You do this MRI, then you see like there is 5. Smaller in some areas that the ultrasound cannot, has a good resolution where it looks. It's like when you're looking with your eye, you get binocular, you see better. So it's more, and in the past we have problem with insurance. Now, the prices are comparable. So there's no reason not every woman not to have MRI. Then MRI will give you idea. You can tell the patient, what to expect. Because even it will show you the vascularity, how much blood is going to the fibroid. There are some other pathology, sometimes, are found during fibroid, another entity called adenomyosis. This is, not as common as uterine fibroid, but again, it is important because, abdominal pain, similar symptoms of fibroids. It is the cousin of endometriosis. Most women know endometriosis because, living in misery when you have endometriosis.
Welcome to Laganova Beauty Salon, where every visit is a celebration. We offer the best in hair, nails, skin, and body services. Our welcoming and relaxed atmosphere makes you feel right at home. We treat every guest like a best friend. From stunning haircuts and colors to relaxing massages and rejuvenating facials, we have everything you need to look and feel your best. Our highly skilled and knowledgeable staff are hand-picked from around the world and use the latest products and techniques to make sure that every service is tailored to your individual needs and preferences. Here at Laganova Beauty Salon, we're all about the details. So why wait another minute to treat yourself? Call now and book your reservation. We can't wait to share the Laganova experience with you.
Միջին տարիքի կանանց շրջանում արգանդի միոմա ախտորոշման դեպքում այժմ հնարավոր է խուսափել բարդ վիրահատական միջամտությունից։ Շնորհիվ նոր տեխնոլոգիաների գոյություն ունի հիստերեկտոմիայի եւ միոմեկտոմիայի ոչ վիրահատական այլընտրանք։ Այն կոչվում է արգանդի ֆիբրոմաների էմբոլիզացիա։ Այս բնագավառի առաջատար մասնագետ բժիշկ Ֆարաջ Հանա Ալկասի գլխավորությամբ Կալիֆոռնիայի առաջատար բուժ հաստատությունում կհեռացնեն ֆիբրոմաները եւ կարող եք դու վերադառնալ նույն օրը։ Այս գործողությունը հաստատված է FDA-ի կողմից։ Բժիշկ Ֆարաջ Հանա Ալկասը էնդովասկուլյար միջամտության, ինչպես նաև արգանդի միոմայի եւ adenomiosի բուժման առաջատար մասնագետ է։
Now, what shall we do when we discover
Right.
after MRI
Right.
that we have?
So unfortunately, as we said, that this is, not well advertised.
Yeah.
There is no reason.
Unfortunately.
There is no reason. We're in 2022, and still, women. I go some places. In community churches or over Zoom, I talk about the subjects, and people, come to me, and they're really tears in their eyes. But why we did not have this procedure 4 years ago, 5 years ago? I told them, what do you mean? This has been approved since 2005. It's FDA approved since 2005. It's really disgraceful. Women still having this invasive procedure, major surgery, and going out of the surgery without their uterus. There are people in their 40s, middle-aged women. But there are people in their 30s. This is really disgraceful.
But let's tell our viewers, what do they do? Because you and I know because of you.
Right.
So most women, they remove. Right? So tell us.
I mean, the treatment of the fibroid, usually, this is like knee-jerk. When you have a pain, you take non-steroidal, ibuprofen, or the same family. Sometimes they work for the pain. Regarding the bleeding, the vaginal bleeding, most gynecologists, they start people on oral contraceptive. So it is good, the mattress that we talked about, the endometrium, regarding the bleeding, the estrogen kind cement, strengthen this layer, so women will not have as much as vaginal bleeding in their menses. But this is a double sword, because you're giving the estrogen to, cement this layer, but on the other we know estrogen is a fuel, is a gas for fibroid. Fibroid likes, estrogen. Actually, they thrive on estrogen. So the problem is you're solving one problem, but you're causing a bigger problem. So this is one thing. The third, more advanced medication is depriving the body from estrogen. So there are multiple ways. There are some medication, stop conversion of the, estrogen aromatase inhibitor. There are other medication, GnRH. These medication usually are given not only for people having fibroid and symptomatic, they're being given for other, medical condition like prostate cancer, some other type cancer, because it gives the impression that, to the body that, the bottom line, it makes the body deprive of estrogen. So what happened, there is tons of side effects of, it's like you're throwing women in a menopause, temporary menopause. It could be like mood changes to anxiety, to feeling fatigue. And what's like more important, like feeling hot flushes. Again, estrogen is good for the bone. So if it is taken for a long period, women can develop osteoporosis. The other thing is estrogen is a good, hormone for the woman. That's why it's cardioprotective. It's good for the heart. That's why you see men having more myocardial infarction than women. But after menopause, both,
In the same page.
genders, they get the same because estrogen is good for the. So these are the main medical, and just to tell you that the last one, the GnRH, some of these medications were pulled out of the market. The other one, they're FDA approved only for 6 months because of the side effects. And honestly, FDA don't have to, give this recommendation because most women don't comply with this because of the symptoms, side effects of the, anxiety. Yeah. And the shortness of breath and the pain is seen most in patients that they have vaginal bleeding because they lose blood more than the body can synthesize. I mean, every person has factory to manufacture RBCs, but when the loss is outweigh the manufacturing, just 2 weeks ago I have a patient, usually the hemoglobin should be around 10 at least for women. She has 6. She frequently get transfusion in the ER. She's with the health system that this health system don't have vascular intervention. They have only GYN. This is their recommendation. You have to have, hysterectomy. She's 38. She's still interested in getting kids.
Yes, of course.
Unfortunately, I saw her. I spoke with her primary physician. I'm not in their network. So let's move to the surgical part.
Yes.
So
the most popular one, unfortunately.
Right.
Unfortunately, yes.
I mean,
the invasive. We're going to speak about what people do without knowing what you can do.
So there's 2 surgical options. Myomectomy. Myomectomy means that the physician go in and remove only the fibroid. But the problem is sometimes women have 4, 5, 6, 7 fibroids. And as we talked, the fibroid, the uterus in nulliparous. Nulliparous, this means women never got pregnant. The uterus size is like the size and shape of a pear's fruit. So it's like 6, 7 centimeters. So if you have multiple fibroid, just remember if you have an apple and there are like some bad spots, like this brown spots, and you want to inoculate them, you remove this, you remove this. If you remove like multiple, at the end you don't have any more apple.
Yes, of
so
course.
This is what happens when you have a multiple fibroids. And you don't know basically which one is causing the symptoms. You might go in and remove X and Y, and the problem is with Z.
Yes.
So this is the problem. And they recurred with the myomectomy.
Yes.
And the problem with myomectomy is still surgery. The recovery time is around 4 to 6 weeks. Wow. Compare that with the procedure that we're going to talk about, uterine fibroid embolization, is like 1 to 2 weeks.
Wow. Less invasive as well.
You don't have to open the abdomen. Doesn't matter what route it is. People will tell you, oh, I'm having this laparoscopic. So if it is laparoscopic or open, or Da Vinci or transvaginal, still, this is invasive and, disrupting.
Of course.
So the most important with myomectomy, I need women to understand, every time, I was at one time medical student and we consent patient before the surgery. So every consent, read it well. In every consent, even if it's myomectomy, they tell you we go in, remove the fibroid only. You're giving in this consent a release form. In the event that there's a bleed and the physician cannot suture the uterus back and there's a lot of bleeding, he has the okay to remove the uterus. So just remember that you have to know the consequences of myomectomy.
It sounds like a tragedy for each woman because you cannot have kids.
2 months ago, I have a woman, young woman, 29 years old. She has a fibroid, subserosal. And for me, sometimes even I got patients, they have fibroid. I think this is most appropriate by myomectomy. She has only one fibroid, subserosal. It's on the outer lining of the, so this is like 5 minutes. It doesn't need to disrupt the uterus. So she refused. And the reason is, they have a bad experience with myomectomy. She's the only kid for her mom. She had fibroid. She went into the OR for myomectomy. She got out, and nobody told her, was afraid to tell her that your uterus is out because they have too much bleeding. So she has only, this is the only kid for her mom, and she refused.
She told me,
she told me, no, I cannot go from the same pothole twice. My mom already, so I cannot go with surgery. She's 29 years old, and she's getting married in few months. So the last option, surgical option, is hysterectomy. Hysterectomy, either with removing the uterus or sometimes removing the ovary or leaving the one ovary. So it is removing the uterus. So the woman cannot conceive anymore. So if it's good that if she completed her family. But again, this is when I heard about this statistics, I was shocked. You're going to be shocked also, and everybody. I mean, hysterectomy is among the most common surgical procedure done in the United States. It's among the highest 5. And if you factor in that half only the population, if you do the math, have only uterus, when you do like a glaucoma, you tell that this is the most common procedure done. But women and men have glaucoma. Yes. They do. But when you have your factoring in, it is the 5th procedure, surgical procedure done for half of the population. This is push it more on the ranking, because you have only half the population have uterus. The rest don't have uterus. It's similar situation with the prostate. So the problem is, once you remove the uterus, this is number one, that you cannot, think about children again. The other thing is there are some side effect complication of the hysterectomy. I mean, women that they have hysterectomy, they know what I'm talking about. And there is no reason women in their 40, in their, there are women in their 30, as we talked earlier. So this is incomprehensible for me. I can't understand it. Every time, I hear a story like this, I get frustrated. So there are risk of infection. It's big surgery. Risk of bleeding, blood clots. I mean, in the younger age group, this is very important. Nobody talked about it. What, they tell them about the hysterectomy. What happened after the hysterectomy? I mean, there are some researchers say that the presence of uterus adds sometimes to the, to the orgasm because of the contraction of the uterus. It might have something to do with this. So all surveys, they ask women, how was your quality of life with the fibroid and after the fibroid? The right question should be, how is your life, after surgery and before fibroids? Because, with the fibroid, they're living misery. Right? So no matter, any help will be good. No matter what you do, you get, you help people with vaginal bleed or some numbness, continuous numbness or constipation, or, I have women, they have same symptoms people have, men have regarding enlarged prostate. They go frequently at night to the restroom.
Yes, that's miserable. And now we have our last 5 minutes, and I would love you to say more about not invasive procedure that you perform, because it was around more than 20 years. And unfortunately, not everyone know about it.
So uterine fibroid embolization, honestly, it started, the name was uterine artery embolization. And what the way it was discovered, gynecologists, obstetricians, they have problem in the C-section or doing some surgery. and or anytime you're in the pelvis as gynecologist, you have the risk, even remove the uterus, you have side effects of injuring bowels, uterus, urinary bladders. So this was discovered when we help urologist or gynecologist, they're having problem controlling the bleeding. We go in and block the artery temporarily until they fix. With time, they figured out that this procedure is helping the fibroid. So they start calling it uterine fibroid embolization. So it's pretty very, it is office-based. Usually it's 1 hour.
Wow.
No cuts. There are 2 routes, either from the top, top of the leg. It's like most people know the cardiac cath, how it's being done from this area. Or now recently, we have a better technology. We go from the wrist.
Oh, wow.
It's less than half a centimeter incision. With the wrist, it's better for the woman for ambulation. Usually after the procedure, we observe the patient 2-3 hours, then they go home. Within 1 week, they can, 1 or 2 weeks, they can resume their regular life. In 3 to 6 weeks, we'll talk together. She will come back and we'll revisit the whole situation. See, 3 to 6 weeks, she might get pregnant if she. And number one, like people tell women that if you do this procedure, you're not going to get pregnant. It's not true. There are tons of paper done internationally, even nationally. Women get pregnant and have full term with normal vaginal delivery. On the contrary, if you you do the hysterectomy, you cannot get pregnant to start. If you do myomectomy, there is a risk that every time you get pregnant, you're going to have C-section. Because by removing the fibroid, you're weakening the muscle of the uterus. So you can't, you allow the patient for a short time vaginal delivery. Because there is too much contraction. You don't want to have like rupture uterus for this. So it's very simple. You go from the wrist area, you thread a tube all the way, you park it where the artery feeding the fibroid. You put a particles that being studied for more than 50 years in the body of the patient. They block the artery. In this way, the next day, if the symptoms are bleeding, it stops instantaneously. When the bulk, when the symptoms are bulk, it takes some time. Within weeks or next cycle, most patients feel a better symptoms. Improvement in the symptoms.
So basically, you just stop feeding that fibroid with blood, and you just block it.
Yes.
And because fibroids cannot be fed, it just stops developing and going smaller, and then
smaller. And this technology is not being done only with fibroid. We do
Makes
this,
sense, right?
cancer all over the place. We feed cancer, we cut the blood. The cancer, we add some chemotherapy or radiotherapy with this. But the concept of blocking the artery, in this way you block the blood and you block the estrogen for the fibroid. And these are the 2 fuels that, fuel. So
amazing, amazing. So non-invasive, so easy. And we just have to be educated about that. We just have to know about that option. That that's the option that can allow us to have kids, to have a normal life without pain, without struggle, because everything you just described, as a woman, I can say it's a struggle.
Yeah, and you don't have to live with misery for 3, 4, 5 years. And you're not giving the other options. At the end, you surrender. You gave up and you have hysterectomy. This is the story. Like every woman tells me, I keep kicking the can forward. Maybe it's going to be better and better and better to reach a point. Like there are some working women,
Yeah.
They don't take any vacation anymore. They keep it for, they told me every time I go, I'm afraid of, some accident. I might soil my, I have always a pair of pants for this situation. I might have accident, I don't know what to do. I don't want to have hysterectomy, and I'm still interested in getting kids. So it is very important, and it is unexcusable, honestly.
Yeah.
Not all gynecologists, but gynecologists doesn't, tell all the options, the surgical and non-surgical, and have the patient decide.
But thank to you, now we know that.
Yeah, it is very rewarding. It's very rewarding because you start getting instantaneous improvement. And regarding pain, people will tell patients that this is painful process. I mean, having your uterus out, it is probably way more. But we are doing great on regarding pain management. Even in my practice, I do additional pain control. It is local. It's called, superior hypogastric block. We go with the needle and block the nerve. It's near the, vertebral body, way back. We block the nerve that usually feed the pain sensation to the brain.
Oh, wow.
So in this way, you cut the highway.
Amazing.
The pain is there. I mean, we're not, but the brain doesn't feel it. Amazing. So we do this despite that we don't get reimbursed for it, because most people don't do it because insurance, they consider it as one package, but we do it just to have patients a smooth sailing the first 24, 48 hours.
Amazing. Thank you very much. Thank you for educating us. Thank you for speaking about such an important things, because it's about the life quality.
Thank you very much for giving us the platform to educate people.
Thank you. Thank you very much.
Thank you.
Dear viewers, thank you for watching us, and see you in a week.